Now for the next issue, which is more of like a joint issue, okay, deposition of some crystals. So we call it what? The chondrocalcinosis. So from the word chondro, you can actually what? Put out chondrocytes. Chondrocytes are what? The cells of what? The cartilage. Okay. So chondrocytes, that's where we got them. So chondrocalcinosis is basically deposition of all those crystals there. So it's just a radiological finding. Okay, you usually see it on imaging. Of course, you can't see inside the joint without imaging it. So you see that when there's what? Deposition of crystals in the joint. Most often is due to what? Calcium pyrophosphate what? Deposition disease. Okay, also known as the pseudogout. Okay, so commonly affect the knees, can affect the wrist too, can affect the hip, can affect the shoulders. So what is chondrocalcinosis? It's just calcium deposition in the joint, So most often is due to what? The calcium pyrophosphate deposition disease. Can also occur when there's other metabolic abnormalities, right? So it's sometimes used interchangeably with pseudogout, but in real terms, it's like a future of pseudogout. Okay. So causes, this calcium pyrophosphate deposition disease, metabolic issues like all those hemochromatosis, hyperparathyroidism, hypomagnesemia, hypophosphatemia, degenerative joint disease, and sometimes it's genetical. So symptoms, sometimes no symptoms. I'm coming. Sometimes, joint pain, swelling, stiffness, reduced mobility. You diagnose it from x-rays, synovial fluid analysis and blood tests. How about the treatment? Drugs to reduce inflammation, like non-steroidal anti-inflammatory drugs, corticosteroids, Then try to tackle what is actually causing it.